Yes.
Hi everyone, this is again from Dr. Taj Clinic. Every Sunday we are doing this program, and likewise, this Sunday we are doing the second episode of pigmentation. Last episode we spoke about what are the
Is it
different
your volume low, Dr. Priya?
I
Can you
don't know,
increase?
maybe I'll speak up. Maybe I'll speak up. Now can you hear, sir?
Yeah, yeah, yeah. Yeah.
Yeah.
Yeah.
Last week we spoke about the pigmentation, the causes of pigmentation, different types of pigmentation, and also a little bit about the management. So, as a continuation of the last week's topic, today is the second episode on pigmentation, where we are going to again do a recap on what we spoke last week, and we are also planning to show you some videos on the treatment of pigmentations. And meanwhile, you can do all your questions in the comment section. We'll try to answer all the questions. And we move on to Dr. Taj sir's presentation on the pigmentation and the recap. Over to you, sir.
Yeah, yeah. I'll just give me a moment. I'll just share the screen. It may take 1 minute.
Sure. So the first part is going to be the recap of what we already discussed last week. And then we'll move on to the treatment and the video part. In the meanwhile, whatever questions you have, please do post in the chat section. We'll try to answer all the questions. And this is our presentation.
Priya, can you see the screen?
Yes, yes, sir. I can see the
Pre-
screen. It is clear.
Presentation, right?
Thank you.
All right. So just a recap. So we have already talked about all these courses, treatment, various treatments, and all that. Today we'll be concentrating more on the treatment part. Okay. So just a recap. So what is hyperpigmentation? Hyper means excess. Okay. Pigmentation means darkening. Excess darkening of the skin beyond its normal color is called hyperpigmentation or darkening of the skin. A few examples are like freckles, melasma, dark circles around the eyes, and even after acne. Or sometimes you can get diffuse pigmentation all over the body. Like when you expose to sunlight, you might get pigmentation all over the body, or maybe after injury or post-inflammatory hyperpigmentation or burns, you might get all over the body. Tonight, unfortunately, Dr. Jyoti couldn't join, so myself and Dr. Priya will be uh, explaining what are the treatments available for pigmentation today. We do have clinics in Coimbatore, Chennai, Palni, Pollachi, Pondicherry, Ooty, and Talasi. Just as a, information I shared, and I'll explain once again why the pigmentation occur. You see, this what you're seeing here is the skin structure. Okay, so here in the bottom of the skin, at the deeper part of the skin, you can see some cells like this. These cells are called melanocytes. These melanocytes will produce melanin, and this melanin will reach the surface of our skin. Then that will give our normal color. When this pigmentation with these melanocytes produce more number of melanin, then that will become darker. This is what happens when you get more pigmented skin. When it is less, when it doesn't produce any pigmentation, that will cause another disease called vitiligo. So now, what are the causes? I'll just run through this. There are internal and external factors which cause pigmentation, that is hyperpigmentation or pigmentation of the skin. What are the internal factors? What are the internal factors like diabetes and increased blood pressure, or any thyroid problem also can cause pigmentation. Certain allergies, hormonal changes, especially during pregnancy, menopause, and some hormonal medicines or OCP, like and steroids and some medication, other medications like antihypertensive or arrhythmic drugs also can cause hyperpigmentation. And what are the external factors? External factors are like due to outside factors. Okay, not from internal, that internal to our body. Like these external factors caused by this sometimes might be due to cosmetic products, excessive use of cosmetics. അങ്ങോട്ട് പോ, hello, ഇത് വെക്കോ. Cosmetic products or excess sun exposure or anything which causes redness to our skin, like any inflammation or any damage to our skin, can give rise to pigmentation. And like pimples can cause pigmentation. And certain procedures, like when we do procedures like lasers and peeling for reducing the pigmentation, sometimes it can also give rise to pigmentation. Now you should be very careful when you're going for a procedures. You should go to an experienced doctor. And sometimes even bleaching and micro needling is another procedure used for the removal of the scars or reducing the scar. That also can cause pigmentation or darkening of the skin. And some home remedies, like when you do when you try to do some procedure on your own, like they say, no, DIY, do it yourself. So that one can cause pigmentation. Now you should be very careful on that. Don't treat your pigmentation on your own, but it is always better to consult a doctor. So treatments depends on the nature of the darkness or the pigmentation. So we have to find out the cause. What causes the darkening of the skin? It can be either due to internal and underlying disease, or maybe just exposure to sunlight or tanning. That we can find out. So we have to doctors can find out that easily, so that when we see the skin, we can find out whether it's due to tanning or maybe due to underlying disease. If we cannot find the cause, maybe we'll have to go for a biopsy. Biopsy means taking a small piece of skin from the skin to find out where exactly that melanin is residing, the level of the melanin. So we can find out where the melanin is present. And we have to take clear history from the patient. Then only we'll find out what is the real cause of the pigmentation. So yeah, in the market you can see a lot of products. This market is flooded with pigmentation products, like products for the removal of the pigmentation. So, and there are tablets also available. They claim to remove the pigmentation. And excuse me, acne and like this acne, that is pimples. Sorry. So acne and acne is a pimple. Acne is also lichen planus, and lichen planus pigmentosa. This also can cause. These are the skin diseases which can cause pigmentation. Okay, so we have to find out any underlying cause. Whether it's due to acne, whether it's due to lichen planus, or is it due to lichen planus pigmentosa. So these are the diseases which cause pigmentation. These are common causes of pigmentation, underlying diseases. Then there are antioxidant tablets which can help reducing the pigmentation or give protection to your skin from getting the pigmentation. And sunscreen, oral sunscreens are also available, and sunscreen lotion and gels are available. We prefer sunscreen cloth with good ultraviolet protective factor. So that is much better than the sunscreen lotion, because sunscreen lotion you will have to use it repeatedly every 2 to 3 hours. You need frequent touch-ups. So we prefer sunscreen cloths. And what are the procedures to remove the pigmentation? So procedures mainly are divided into chemical peels or lasers, some other device dependent treatments. So what are the chemical peels? Chemical peels are applying a lotion to the skin superficially. There are different types of chemical peels. This will exfoliate the skin and it will rejuvenate the skin. It will remove the pigmentation to a certain extent. Superficial pigmentation will get good, excellent result with some chemical peels. So there are different types, mainly 3 types of chemical peels: superficial, medium depth, and the deep. And actually, we already told these presentation is mainly for the doctors and for the common people. That's how we have prepared our presentation. So both can understand. All right. And what are the lasers available? There are Q-switched NDI, Q-switched Ruby, Q-switched Alexandrite, and fractional lasers also available. And these are all the lasers which are available for the treatment of pigmentation. And let's check what are the how we do the procedures. What are the procedures? The first one, this lady had pigmentation after lichen planus pigmentosa. This is a condition where the pigmentation lies deeper to the skin. Ointment doesn't work, and even chemical peel also sometimes work, but it won't work much. You need laser treatment for this. The pigmentation is lying very deep, and it will take some time to go off. Okay, and we can use laser for under eye pigmentation also. While treating under eye, we should be very careful. We need to have eye shield if we are treating under the eye. So that also laser will help. And there also we are what you are seeing. We are use Q-switched and diag laser. Then we do have another laser called fractionated CO2 laser. This can be used for even the freckles also. That's why we are showing this video today. Actually, this has been used for skin tightening, acne scars, and resurfacing, all kind of rejuvenations. So here, even the freckles could be removed with the fractionated CO2 lasers. And we can use some kind of peels, a spot peeling we call it. I got TC application with a toothpick or very thin stick. We can apply the chemicals on these freckles. Immediately there will be darkening of the skin, and after 4 to 5 days it will fall off. But it is always better to comparatively laser will be better, but here the expense will be less if you are going for this kind of peeling. It's called TCA peel. You can use either 35% or 50% or even 70%. So immediately after that, there will be, you can see the frosting. This is called whitening, is called frosting, and that will become darker, more darker than the usual freckles. After 4 to 5 days, it will usually fall off. This is spot TCA peel. Next, we'll see this. Actually, this is myself. I got so many problems. I got freckles. I had freckles. I had seborrheic keratosis, and I had under eye pigmentation also. Here also I had pigmentation. So why I was the patient here? I want to be a patient because I want to show the people that this is a filler. Is nothing to worry about the filler if you are doing under eye. It's the same procedure. You can see the filler going down there, and then it fills up there. It will reduce the pigmentation as well as the wrinkles. You can see all the wrinkles. If you see now, all the freckles we have treated. All right. So you can go for Q-switched NDI laser for the freckles, seborrheic keratosis for the CO2 laser, and these fillers for the under eye darkness and wrinkles. Then for under eye pigmentation, we can do mesotherapy. Mesotherapy is a injection, like we are injecting into the dermis, at the level of our skin, that's called dermis, we'll inject. So mesotherapy will be little less painful compared to the usual injections. So vitamin C injected under eye will give excellent result for the pigmentation under eye, or even for the other sides of the face. This is the organic peel. This organic peel will help in reducing the tanning. You will see the immediate improvement. It won't last much, but immediately if you want lighten the tanning, you can go for that. That will give temporary improvement. And now we'll see what are the other procedures. This is another pigmentation called the fan or brush. And this is yellow peel. You can do it under the eye also. We are showing short videos so that what are the treatments available. We are not showing all the videos. The purpose of this session is to answer all your questions. This is Obaji peel, blue peel, Obaji peel. So this also will give good improvement for the acne scar and also for the pigmentation. Then all these combination peels will have downtime. And this is another peeling called SA peel. It will reduce the pigmentation after the acne. It will reduce the acne, and especially for the inflamed red color, you can see over the inflamed acne, it will give wonderful results. It will open up the pores. This is called that. It will reduce the pigmentation also. And let's check what is this. This is under eye treatment. Another treatment for this, we call it like eye cell treatment. We don't want to tell the brand name and all that. This is serum and rolling. You can listen to the music and see the video as well. The serum are applied and we are rolling with microneedling like in a small one so that the particle enter the skin to lighten the skin. And after that we will put a under eye patch, the polypeptide patch. We will keep it for 10 to 20 minutes. And soon after that, we will give some cream. The patient can apply the cream and go back home. And we will give a maintenance cream for that. Now, and melasma is a very common condition. One thing we have to tell you this: melasma, with whatever the treatment you take, you cannot tell that we can cure 100%. You can try both, keeping the laser into the skin and away from the skin. Also, we tried different types of lasers. We have different types of peeling, but we cannot give guarantee or any assurance that the pigment won't come back. Whatever the treatment you take, there are so many treatments will give very good improvement, but we cannot assure you that it won't come back. There are lasers also available just for removal of the pigment, melasma. This is fractionated erbium laser. This pigmentation after the trauma. So for trauma, skin also will be atrophied. The skin will be thin. So this fractionated erbium laser will give excellent result for removal of the pigmentation and for the improvement of the scar tissue. This is a carbon peel for glow. This what you are seeing is the carbon particle are getting removed. This kind of video has gone viral. The people thought that whatever you are seeing, the whitening is the result. It's not the result. Actually, we are removing the carbon particle. That is the real color of the skin we are seeing. And all surrounding the skin, what you are seeing is the carbon particle. So we are removing the carbon particle, not the color. Okay. So people have been misguided because of that viral video. So this is another kind of education what we want to give you. This is carbon peel, but you will get a tightening feel or a refreshed skin after carbon peel. And you can use pulse dye laser also for the removal of pigmentation. Pulse dye laser is actually used for the treatment of vascular lesions, that is blood-related pigmentation. But that can be also used for the treatment of pigmentation. And this is commonly used combination peel, yellow peel. This will give excellent result. And only thing is that downtime sometimes is unpredictable. Sometimes there won't be any downtime, maybe 1 or 2 days. Sometimes peeling will keep on extending up to 10 to 15 days. But the results are excellent. Most of the way, 90% of patients are happy with this. So we'll apply the yellow peel. We'll ask the patient to wait for half an hour to 2 hours. Then we'll ask the patient to go home. And all need sun protection. Now we'll show you a few more videos before going to the discussion. Then these are this freckles and post-inflammatory hyperpigmentation treatment done with QC NDR laser. So enjoy the video, enjoy the song. I don't want to be the shadow of the bigger picture. Okay, let's check what is the next in store for us. So this is QC-NDA again for post-inflammatory hyperpigmentation. So this guy had severe acne and it led to pigmentation, that is post-inflammatory hyperpigmentation. So we are treating this patient with QC-NDA. This people we did very recently during pandemic. It's very safe because only forehead we have been treating, and we have taken we followed all the guidelines of pandemic precautionary methods. And this is another laser can be used for the pigmented growth. This is almost like painless. You don't need an anesthesia for this. So this is a new laser, relatively new. The black spots and all which is raised, we can remove with this, and also freckles also can be removed with this laser. The best part of this laser is like it is relatively painless, and downtime is very less. Just like CO2 laser, it's also like precise. And you can do near the eye also. That's why we have shown this video. We can near the eyes also. We can do that. It's very safe. And now this is again like this is like some mixed kind of lentigenscias, osseous, freckles, and we are treating with lentigens. You will require more sittings than freckles. Freckles may go with 1 or 2 sittings. Lentigens or other nevus will take more sittings. So just showing all this video just to show you that there are so many treatments available to remove or once again remove or reduce the pigmentation. This is again fractionated CO2 laser. You can remove the pigmentation from the lip. Okay. Lip pigmentation is very good. For fractionated, we can combine QC-NDA laser also with fractionated CO2 laser. So here I think we have some connectivity problem, but it will be fine. We'll just check. The net is down. Okay. Now acne scar like erythematous, reddish acne scars, even for the acne, this wavelength is very good. So from 520 to 585, we can the red colored pigmentation. Even after acne, even for the acne, this is very useful. That is QC-NDA with 585 nanometer handpiece. Then this is like, I just want to tell you, this is a pulse dye laser. Actually, this is being used for this handpiece is used for the vascular lesion like port wine stain, hemangioma, all that. But this is for the this for use for the treating vascular lesions. Okay. So this is 7 mm you can see, and the tip you see this is open. Now I'll show you which tip is used for treating pigmentation. See, this tip is used for the treatment of pigmentation. Okay, melasma especially it has got vascular component, and we can combine other lasers with this, so we can get better results compared to any other laser because vascular component is common with melasma, and many people ask this laser. So this is a tip. You can see the glass. It will compress the blood vessel. It will target the melanin. Let's check what is in store for us. Next one. This is okay. Again, what we are doing is like now we are applying the anesthetic cream, because this laser what we are going to do now, it will be a little painful. So we have to apply anesthetic cream, and we will ask the patient to wait for 30 minutes, 30 to 45 minutes. After that, we will do a laser. The fractionated RPM we have laser. This is also fraction. This is fractionated RPM. This laser has got FDA US approval for treating melasma. This is the only laser which has got FDA US approval for the treatment of melasma. Fraction, restore. No other laser has got FDA approval for the treatment of melasma. And these are different types of field. This is a Jesner's field. It's mainly used for the treatment of acne. It's also used for the treatment of reducing the tanning and pigmentation. This is how we apply. We will apply Vaseline or white petroleum jelly so that it won't get collected. The peeling agent won't get collected around the nose or around corner of the nose. I think we'll finish for so many questions will be there to be answered. So I'll just show you a few more videos, then we'll wind it up. This is a glycolic acid peel. This is very good for removal of tanning. The same methods. The only thing is that this has got neutralizer. We'll neutralize this with a neutralizer. That's sodium bicarbonate. I think this stopped. I got some problem with the connectivity internet. Okay, no problem. That's about Jesner's field. And that's all for today. I said a video, and we'll come back to answer all your doubts. All right, Priya, do you have any questions?
Yeah.
Have you answered almost? I hope you must have answered all the questions.
No. Okay, we have the question section. I cannot see the question section here.
I think
you have covered almost all the topics regarding the pigmentation, and the pigmentation also comes as a nevus. People don't know nevus. It is a nevus, and they come as a pigmentation unilaterally or bilaterally on the face. I think you can also give a brief explanation on how to treat a nevus on the face, which mimic a pigmentation, or what are the types of nevus that mimics the pigmentation on the face.
Yeah, as I said, there are nevus, so many nevus which cause pigmentation. By birth, you will have nevus of aorta, nevus of E2, can be bilateral or unilateral. Then for that, you need definitely you need laser treatment. No peel will work, no ointments will work. The gold standard treatment for the nevus of aorta or E2 or lentigens is a Q-switch NDI. Only laser will work for that. And from internal disease, I already have discussed, I think. There are so many questions. We can start answering all the questions. Is there any home remedy? If there is any, can you explain in Malayalam? Okay. Of course, definitely. Yeah, home remedy ഉണ്ട്. Home remedy ഉണ്ട് വീട്ടിൽ നിന്ന് ചെയ്യാൻ പറ്റുന്നത്. എന്താ വെച്ചാൽ ഫസ്റ്റ് എന്താ ചെയ്യേണ്ടത് വെച്ചാൽ ഉള്ള സാധനമൊക്കെ എടുത്തിട്ട് കൈ കിട്ടുന്ന സാധനത്തിൽ എടുത്തിട്ട് പെട്ടെടുക്കാം. വീട്ടിലുള്ള ഇപ്പൊ വെച്ചാല് അലോവേര ഉണ്ടെങ്കിൽ ഉപയോഗിക്കാം. ഓക്കെ, അലോവേര എന്ന് പറഞ്ഞാൽ അത് വേണമെങ്കിൽ ഉപയോഗിച്ച് കഴിഞ്ഞാൽ കുഴപ്പമൊന്നുമില്ല. പിന്നെ വേണമെങ്കിൽ ടൊമാറ്റോ, ഇതൊക്കെ ഉപയോഗിക്കാം. ഈ ചിലപ്പോ ഈ മഞ്ഞൾ എന്ന് പറഞ്ഞ മഞ്ഞളൊക്കെ ചില ഉപയോഗിക്കാറുണ്ട്, ടെർമറിക്. അതൊക്കെ ഉപയോഗിക്കുമ്പോൾ എന്താ വെച്ചാൽ പിന്നെ വെയിലത്തൊക്കെ പോയി കഴിഞ്ഞാൽ കൂടുതൽ ഡാർക്ക് ആവും സ്കിന്ന്. അത് നിങ്ങൾ ശ്രദ്ധിക്കണം. അത്ര ഹോം റെമഡി ഇതൊക്കെയാണ് ഉള്ളത്. അധികം വെയിലത്ത് പോകാതിരിക്കാം. വെയിലത്ത് പോയി കഴിഞ്ഞാൽ കുറച്ച് പിഗ്മെന്റേഷൻ ഉണ്ടെങ്കിൽ കുറച്ച് വെയിലത്ത് പോയി കഴിഞ്ഞാൽ ഇത് കൂടുതലാവും. അതാണ് വേണ്ടത്. ഹോം റെമഡി എന്ന് പറഞ്ഞാൽ അധികം വെയിലത്ത് പോകാതിരിക്കുക, അതാണ് റെമഡി. ഓക്കെ, വെയിലത്ത് പോയാൽ അത് കൂടും. I hope you can see my question. Yeah, hi, Sana. Yeah, we could see Neetu. Hi, hello, Neetu. Hello, Prabin. Hello, Prabin again. Nitin. Is age a factor for doing laser treatment? Yes, some lasers. Yes, for it's a good question. For a hair removal, we don't use. We don't start before the age of 14 for cosmetic reasons. There are other reasons like spina bifida causing hair growth. That is a congenital mal deformity. For that and all, we can use. Or after surgical or after plastic surgery, a patient might have some hair growth on the recipient area where the graft has been placed. There you might have some hair. There, that condition and all, we can use hair removal laser. And but for the vascular lesion, that's like port wine, like red birthmark, some people will have one side or bilateral. For that, we have to start as early as possible. Even we are treated even 2 months old baby, because sometimes if you don't treat early, that can become worse. So that is a condition called port wine stain. That we have to start as early as possible. So earlier the treatment, the better will be the result for vascular lesions. So it is a factor. But for resurfacing and the acne scar removal, all this thing, like we have to wait. And for the nevus of photo also, like sometimes that kid will have problem in facing their friends. So some social inhibition may be there because of nevus of photo. There is a that is a mole. In that case, we can start a treatment early. So, is there any permanent solution for pigmentation? Yes, I think you can answer, Priya. Is there any permanent solution for pigmentation?
That depends on what is the reason for your pigmentation. So if it is a post-inflammatory pigmentation which you got out of an acne or some kind of an inflammation or a skin disease, primarily we treat the cause of the problem and then we treat the pigmentation. In that case, definitely we can achieve 100% result, like a permanent solution for the pigmentation that you have, and providing you don't get the problem again and you follow the maintenance properly. There are some conditions in which we need to have a maintenance for a prolonged time. As Sir mentioned, melasma is one of its kind, LPP. All these conditions are little chronic, which needs a prolonged treatment. Other than that, pigmentation, you need, uh, obviously, you can have a 100% result if you treat it properly. Yes.
Okay, do we have another question? Okay, so many people wanted to know the home remedies. So, um,
Home remedies work better when you don't have any major issues on your skin. So if you just want to maintain your skin or just to add to
the
your
Priya,
pamp,
there is a comment from Shobha that can't hear Dr. Priya.
yeah,
So
now
maybe,
now can you hear? Is it audible now?
yeah, it is a little better, but we can do it a little more. Can
Okay.
it stand yeah, near to the microphone, or
Now is it
can
audible?
you bring it closer?
Yes. Is it audible now?
Yes, it's audible. Yes.
Okay.
Yeah, yeah.
So about the home remedies work better when you don't have any major issues on your skin. You just want to maintain your skin or just to do the little pampering. Home remedies will definitely help. But I don't think home remedies can treat a problem. Like if you have a melasma or a serious post-inflammatory hyperpigmentation, you cannot entirely rely on a home remedy. So home remedy is just for a pampering and to like treat your skin, and you have to be very careful what product you are applying on the skin, especially the acidic products like lemon, garlic, apple cider vinegar. All these are astringents which can easily burn your skin. So whatever home remedy you're trying from YouTube or from friend suggestion, always do a test spot and wait to see if there is any reaction, and if there is nothing, then you go for it. So it can use as just a maintenance and just to pamper your skin. That will help. Yeah.
Okay, there's another question. Sir, you explained about blue peel and yellow peel. What's the difference, sir? Which is best? Okay, good question, Anida. Blue peel contains a stronger chemical. Yellow peel contains a little less stronger. So, blue peel is actually used for pigmentation and for the scars as well. Yellow pill is mainly used for the reducing the pigmentation. So we cannot say which is best. Both are good, that depending upon the skin's condition. And every pill, any procedures depends on how the patient's skin reacts to that treatment. So we cannot say that which one is best. For if you are that patient is having pigmentation with scars, we'll recommend blue pill. If the major concern of the patient is pigmentation, then we'll recommend yellow pill. Anita, I think that will clear your doubt. Venkat, hi Venkat. Okay,
Is
so
there any medical treatment for pigmentation, sir? Would you like to add on any medical treatment? Like we have discussed about the procedures. So
yeah,
apart from procedures, do we do anything for pigmentation?
yeah, pigmentation is depending on the age of the patient, and duration of the pigmentation, site where it is lying. Depending on that, we'll prescribe some medicines. If it is under eye, you should be very careful on the pigment treatment part, because it is delicate skin and it is close to the eye. We have to give very mild ointment, which can contain very low dose of retinoids and vitamin C. That will help in reducing the under eye pigmentation. Should be very careful on that. If you have a deeper pigmentation, you can add hydroquinone. Hydroquinone is banned in certain countries, not in India and the US. But European countries, hydroquinone is banned. So hydroquinone with very little, like 2%, 3%, you can use for the treatment of melasma. And licorine extract, and it is also very helpful. And vitamin E containing cream also will reduce the pigmentation. The major part is usage of sunscreen. Sunscreen is the main thing. Prevention is always better than cure. Everybody knows that. So sunscreen is the best thing of treatment. Any treatment we start for the pigmentation, start with sunscreen. Then we'll reduce the pigmentation. So that you have to protect your skin from exposing too much to the sunlight. You want to add more to that, Priya?
Yes, sir. That is the thing. Sunscreen is the most important thing, and sunscreen can prevent the pigmentation from coming. And when you see the signs of pigmentation, it is always better to treat it early. So don't wait for it to spread. So the smaller the size and the depth and the area of the pigmentation, it is always easier to treat rather than a big patch. So start early and protect always. That is the key.
So another question, what about vitamin C? I already mentioned, we have already shown the video also. Vitamin C is very good, powerful antioxidant, and it will help in the reduction of the, it has got antioxidant property, and it will reduce the pigmentation of the skin. And also, as I just said, it can be used under the eye also. And this serum and lotion, we can do as mesotherapy. We can give injection to even under the eye also. And sometimes we'll get excellent result with mesotherapy with vitamin C alone, even for melasma. I hope
Sir,
that will clear.
yeah. What about this glutathione, sir? Always people are coming and asking for
Yeah, you
glutathione.
can talk about that, Priya.
Yeah.
You get more patients for glutathione than me.
Glutathione is an antioxidant and supposedly in very high doses help in lightening of the skin, which cannot happen to all the patient. But nevertheless, it is a harmless thing. We already have glutathione in our body. It's an antioxidant, so it will just boost up your antioxidant level. That is it. But if you have a specific pigmentation problem like a melasma or a acne pigmentation, we cannot rely on a glutathione or a glutathione injection to treat that. Glutathione injection is just for an overall well-being.
Another comment, Dr. Priya, you are not audible. You have seen the comment?
Yeah, I can't see that. I tried to speak.
Last time it was echo, now it's not audible.
I think some problem with my microphone. Okay, so the
But can
glutathione,
you, can you, Priya, can you remove the earphone and speak?
Now is it
Yeah.
audible?
Yes, excellent.
That is because of my microphone. Okay.
Correct.
So the glutathione, if you want, like you can take it for an overall well-being or overall brightening of your skin, but glutathione injection or a tablet as such will not treat a particular pigmentary problem. So for that you need a specific treatment. So don't go by this ad and all these YouTubers advising glutathione injection and tablet for all the skin problems and the pigmentary problems. It's just an adjuvant treatment. It cannot really treat any pigmentary problem. So that is what about glutathione.
Yeah, we have seen improvement with glutathione injections, but it's all temporary. We'll have to maintain it with tablets. So it is high, very potent antioxidant. It has given results, but not to everybody. The results vary from patient to patient. There's another question. I have dark lips. Any treatment? Already explained. I think Priya can give.
Yeah. So the dark lips, we have creams, but we don't have much results with the cream. So that we use a peeling and a laser. Between peeling and laser, we've seen laser giving better results. We often use fractionalized laser for the lips, and also protecting your lips from sunlight and avoiding, if you have any smoking habit or biting or peeling your skin, that you have to avoid, and you have to moisturize your lips properly. So all this being done, and then we can go for a laser. And definitely fractional CO2 is the best so far in treating the pigmentation, and you can maintain it with the depigmenting creams. There are also specific creams available for lips, and we can also do a peel on the lips, a mild peel just for an exfoliation. So after the peel, when you apply the cream, the results will be better, and after the peel, after a few weeks, you can go for the laser also. So we can do it as a combination therapy. So the lips, these things will work better.
Yeah, we can combine the laser like Q-switch Tendiag and these fractionated lasers.
Fractional lasers.
Yeah, 1 or 2 sittings, we have seen excellent results. And another thing is that your lips look better when it is moisturized.
Yeah.
Any
Some
other
lip
question?
products like lipsticks and other things can also cause dermatitis or an allergy to your lips, and it can darken. So you have to be very mindful on what you're applying on the lips, and proper exfoliation and moisturization is very, very important for the lips.
Okay, I think we have got three more minutes left,
Okay.
and we'll wait for a few more questions. Otherwise, we'll talk about how the sunscreen clothes will help. How will you compare sunscreen clothes and the usual sunscreen or gel?
That I think we have to do a study, since now we have come out with the cloth. One thing we can do is about the complaints of the patient, which one is more complaint, or the liking, which one the patient likes or the person likes more, that we can do, and the protection. Because we don't have any studies so far, it is the ideal time for us to do a study on that, about the complaints and the protection factor. Definitely the protection will be better because we don't need the need for reapplication and things like that. So, but the compliance, how well it, I mean, I worn it by myself, it is good for some time, but I have not worn it for a long time, like hours together. So we have to take that into consideration. So we are planning to do a study on that, and hopefully we'll have more info near future.
Yeah. Good. But it is less expensive also. Like as you said, frequent touch-ups are
Yes.
required for sunscreen, and this is like will give protection from the dust or maybe some bacteria also. Then we
And
can
in
add.
this, yeah, this pandemic time, it also helps as a mask. So you don't have to wear a separate mask. It's like a
Yeah.
2-in-1, sunscreen and a mask.
Another question: is Vaseline good for the lips? You can answer, Priya.
Vaseline, any kind of petroleum jelly is good. So unless it has any fragrant or a coloring agent, and if it is not irritating your skin, definitely Vaseline is good. The point is you have to reapply. Most people think applying once is enough, but it's a moisturizer, it gets absorbed. So the key point is you have to reapply whatever moisturizer, Vaseline or a lip balm you're using. So reapplication and proper exfoliation is the key factor. Vaseline is of course good.
Okay. I think we have got 1 more minute left, and we
Okay.
should wait for 1 more minute, and more questions will answer. Or we have missed anything out, Priya?
Yeah, we have would you like to say something on over-the-counter drugs? Because we have seen people applying some creams and coming with I mean, like
Yeah, I think,
rashes and
I
peeling
think
and
Priya, you can talk
BIH.
on, yeah, you can talk on that.
Yeah. So most of the time, your friend or your colleague or someone, a pharmacist, when you go to a pharmacy, they will suggest you some creams for your pigmentation problem. So some of them are like has a stronger agents like a bleaching agent, which can irritate your skin. So when you're using a bleaching agent, it should be always under the supervision of the doctor. If you apply that, especially in the daytime, or if you don't know how to use it, we have seen a lot of people coming with a complication after using a cream like that. It is not just an superficial thing. It can literally damage your skin. We can see thinning of skin, like we can see small vessels, like the skin gets thinned so much, the blood vessels will be visible, there will be redness. And the people who don't have acne after using these over the counter products develop acne. They become very sensitive to light and even touch. There will be burning and itching
Right. Yeah.
sensation. So please don't go for an over the counter stronger creams unless it is prescribed by a doctor. And if a doctor prescribes a cream to one person, it doesn't mean that you can have that prescription and buy that cream. That cream is meant for that person because as doctor has seen the person and analyzed him. So just don't go for the over the counter creams without a prescription and a consultation from the doctor. That is what I want to mention because I've seen a lot of people doing that.
Mm.
Do we have any other questions, sir?
No, only the home remedies. No, people are been asking home remedies frequently. So, so we can tell them all this contains little very mild acid, fruit acids in some of the fruits, and that could be helpful
Yeah.
in reducing the pigmentation.
They can
But
go for this curd and gram flour. Curd has lactic acid, which is very mild. So the chances of irritation is very less. So the curd and besan is like a age-old gold standard home remedy. So that is comparatively less harmful than a lime juice or an apple cider vinegar. And also if the turmeric is very, very common in southern part of India, but what kind of turmeric you're using is very, very important. It should be an unadulterated natural form. What are the things that you're getting from the shop? It is usually adulterated, mixed with chemicals, and it can stain your skin more and it can also dry your skin. So go for the safest option. And as I told before, always do a test patch.
yeah, you can apply even apple, papaya, both contain malic acid. Tomato also, tomato paste.
Yes.
It contains malic acid, ascorbic acid, that's vitamin C, and also citric acid. So lemon also contains citric acid. So you should be very careful. But keep on applying lemon can irritate the skin. It can aggravate your pre-existing skin conditions also.
Yes.
I think we are over time. I think we passed on 45. So Priya,
Yes. Yes. You are past few minutes. 7:45. I think this was a good session. I hope we have answered all your questions. This is something that we've been doing every week. This is just to educate the general audience and also give an info on the latest procedures and the treatments that are available for the common dermatological conditions to even the doctors who are practicing aesthetic medicine. So this is, we are planning to do it every week with some interesting topic, and we are planning to make it more informative with videos and live demos and discussions and answering the questions. And I really hope this is being very, very useful to all of you. Whatever comments regarding the improvement and the suggestions you have, that also you can put it in the chat box, not just the questions. We'll try to improve. And we'll see you next Sunday, same time, 7 p.m. in the evening with a very interesting topic. Thank you, Dr. Taj, for the presentation. We'll see you next week. Bye.
bye.
Bye.